Global pandemics aren't new, but our knowledge of how to beat them has dramatically improved in modern history. Here's a brief look at how previous outbreaks have prepared us for today. In 1918, the Spanish flu swept across the globe, infecting about a quarter of the world's population and killing more than 50 million people. Without a vaccine, antiviral drugs, antibiotics, or ventilators, closing schools and banning public gatherings became the only way to stop the virus from spreading. In the US, the response was varied. In St. Louis, Missouri, city officials immediately canceled school and capped social gatherings, while in Philadelphia, Pennsylvania, people went about their business and even allowed a widely attended Liberty Loan parade to take place. As a consequence, Philadelphia saw a considerable increase in deaths during the fall of 1918. By contrast, the city of St. Louis was able to flatten its curve. While a truly effective vaccine was never developed during this time, isolation, quarantine, and good personal hygiene helped stop the spread. More than 100 years later, these same methods are still being applied to the COVID-19 pandemic. Polio has been around for thousands of years, but in the mid-20th century, it became one of the most feared diseases in the world, paralyzing hundreds of thousands of children every year. In 1929, the iron lung was created to provide breathing support for people with paralysis of the respiratory muscles. It wasn't until 1955 that a safe version of a polio vaccine was released to the public. 2 years later, the annual number of polio cases began to dramatically decline in industrialized countries. In 1988, the Global Polio Initiative was created to help deliver vaccines to underserved communities around the world. Through this initiative and other global health efforts, polio is now 99.9% eradicated worldwide. The global capacity for vaccine research and development is far greater than it was in the 1950s. Already, just months into the current COVID-19 pandemic, there are far more vaccines in development against coronavirus than there ever were against polio. Immunization remains one of the most successful health interventions in the history of medicine, saving millions of lives every year.